Hello everyone, today's video I am going to discuss about the diabetes mellitus. Okay, and in this topic I will cover the introduction, etiology, and the pathophysiology of diabetes mellitus. Let's take the introductions of diabetes mellitus. First, diabetes mellitus is defined as a heterogeneous metabolic syndrome characterized by the chronic hypoglycemia. Okay, first one, what the diabetes mellitus? That is a heterogeneous metabolic syndrome and which is characterized by the chronic hyperglycemia. That means increase the blood glucose level. Okay. Next, it is most commonly occurring chronic endocrine disorder which affect almost each and every cell of the human body. Okay, or diabetes is affect each and every cell of the human body, and it is a result due to the insufficient insulin production. That means the production of insulin is insufficient and inability of the body to utilize the insulin produced, that is insulin resistance, and increase the synthesis of glucose in the body. When the glucose level of the body is increased, then that is result to the diabetes mellitus. Next, this is a blood sugar chart which is in which that percentage fasting, that is in morning times when we are check the blood sugar, then it is normal for a normal person who don't have the diabetes is 70 to 90 mg per hour, and the persons who have the diabetes mellitus already diagnosed are having the normal, for them normal is 80 to 130 mg per dl. Okay, next, after the 2 hours of meals, and for normal person without having the diabetes is less than 140 mg per dl, and the persons who already diagnosed with the diabetes mellitus, for them the normal is 180 mg per dl. Okay, and NbA1c which is less than 5.7% is for normal persons without diabetes, and 7% the persons who have diabetes. Okay, this is the blood glucose chart for diagnosis of diabetes. Next is the classifications. Okay, the classifications of diabetes we can classify into three types. Okay, first one is type 1 diabetes, which is also called insulin dependent diabetes and juvenile onset DM. Next one is type 2 diabetes, which is also called non insulin dependent DM or maturity onset DM, and third one is gestational DM. Okay, in type 1 diabetes, what happened? The destructions of insulin secreting pancreatic beta cell of islets of Langerhans is occurred. Okay, and due to this the type 1 diabetes is occurred. That means what happened, the insulin, we know that the insulin is secreted from the beta cell, okay, of pancreatics, and when the beta cell of the pancreatics is what destruct, okay, or damaged, then they are unable to produce the insulin for the body. Okay, and for that what happened, the blood glucose level of the body is increases, which is called type 1 diabetes, and the onset of symptoms is rapid in type 1 diabetes. In type 1 diabetes, what happened, the symptom shows is very rapid, and they are mainly occurs in juvenile, that means children. Okay, juvenile means children. And next is type 2 diabetes. In type 2 diabetes occur what happens when the insulin deficiency or resistance or both. When the insulin deficiency means what, the pancreatic cell is secreting the insulin, but they are not sufficient for the to maintain the blood glucose level. Okay, or the body is sufficient amount of insulin is secreting, but the cell is not accepting this insulin, or that is called resistance. Okay, for that reason the blood glucose level of the body is increases, and that is called type 2 diabetes. Okay, in type 2 diabetes what happens, the symptoms is slower and less marked than the type 1 diabetes, and the disease usually progresses to such an extent that it required external supply of insulin in order to maintain blood glucose level. And next is gestational DM, that is this type of DM mainly occur during the pregnancy, and it goes due to the carbohydrate intolerance. The diabetes which is occur during the pregnancy, that is called gestational DM. That means the patient don't have any history of diabetes, but during the pregnancy certainly the patient is diagnosed with DM, that is called gestational pregnancy, and it is occurred due to the carbohydrate intolerance. Next is the etiology of diabetes mellitus. That is, first one is what? Damage to pancreatic beta cell or isolate of Langerhans leads to deficiency of insulin. That is type 1 diabetes. That means when the beta cell is disturbed, damaged, they are unable to secrete the beta cell, and that is cause the deficiency of insulin. Okay, next is secretory problems leading to insulin deficiency or resistance or both, type 2 DM. Okay, when the secretory means the beta cell is unable to secrete, or the beta cell is less secreting the insulin, and due to this the insulin deficiency is occurred, or the body is not utilizing the insulin which are produced, and that can reach the resistance, or the both insulin deficiency and resistance occur type 2 diabetes mellitus. Okay, next is the genetic factor, that is genetic disorder pertaining to functioning of beta cell, which may mainly involve the chromosome 12 hepatocyte nuclear factor HNF 1 alpha 7 20 HNF 4 alpha 13 17 and 20. Okay, and next is Down syndromes or Turner syndromes and Klinefelter syndromes may also lead to DM. Okay, these are the genetic factor which can lead to the diabetes mellitus. Next is the disease. Some diseases are there which can cause the diabetes mellitus, like cystic fibrosis, neoplasia, trauma, or pancreatectomy, etc. can cause the DM. And number B is certain endocrinopathy like acromegaly, pheochromocytoma, crossing syndrome, etc. may also lead to DM. And uncommon forms of immune-mediated diabetes is caused by the anti-insulin receptor antibodies and Stiffman syndrome, etc. This can cause the diabetes mellitus. Number 5 is infections like caused by virus like cytomegalovirus, congenital rubella virus, etc. may also lead to the DM. And drug or chemical such as atypical antipsychotic, corticosteroid, diazoxide, nicotinic acid, thiazides, pentamides, interferon A, phenytoin, acetazolamide, caffeine, glycerol, lithium, salt, niacin, rifampin, oral contraceptive, clonidine, sympathomimetics, etc. may also induce the DM. And factors like obesity, advancing the age, emotional stress, and vasculitis in high perfusion tissue like kidney, eye, etc. may also cause the DM. This is the etiology of DM, or which can cause the DM. Okay, this is what first one is for type 1 is what? The beta cell destruction. Type 2, for type 2 is secretory problems for the beta cell, and next is genetic factor, disease and infectious virus which can cause the DSA, and drug and chemical, and the other factor like obesity, advancing age, emotional stress, and vasculitis in high perfused tissue like kidney, eyes, etc. may also cause the DNA. Next is the pathophysiology of type 1 DM. Type 1 DM is occurred due to the complete deficiency of insulin as beta cell of pancreas are destroyed. The mechanisms which is explain the pathogenesis are follows. First one is autoimmunity. Okay. In autoimmunity, what happened? The immunological destructions of beta cell lead to diabetes. And these immune mediator destructions can be supplied by the following evidence. First one is what? Presence of lymphocytic infiltrations around islets of Langerhans. Okay, and occurrence of islets cell antibodies against the insulin and glutamic acid decarboxylase, and T cell mediated cytotoxicity or apoptosis which selectively destroy insulin secreting beta cell. Okay, this is the pancreas, and in this, these are the pancreatic islets. Okay, and in this, these are the beta cell, and this is for the normal islets, and this is for the type 1 diabetes islets. Okay, where we see that the beta cell is, all the beta cell are destroyed, and due to this, what happened, the due to the destructions of beta cell, what happened, the immunity, sorry, the insulin of the body is not produced. Okay, and these are occur due to the first one was presence of lymphatic infiltrations around islets of fingers. When the lymphatic infiltrations are present, next is occurrence of islet cell antibodies, means when the islet cell are makes some antibodies against the insulin and glutamic acid decarboxylase. And next is when the T cell mediated cytotoxic or apoptosis is occurred, and which are selectively destroy the insulin secreting beta cell. Okay, this is the immunity, and due to this, the diabetes mellitus is occurred. Next one is metabolic abnormalities. In metabolic abnormalities, what happens when the increased secretion of counter-regulatory hormones of insulin like glucagon, growth hormone, cortisol, and catecholamines increases, the production of glucose from liver. Metabolic abnormalities mainly arise and due to acute infection or disease, and due to this, what happens, the insulin secretion is less, and the diabetes mellitus occur. Number 3 is environmental factor. Environmental conditions do not actually cause DM but aggravate the disease. Certain virus, cytomegalovirus, cocci beta virus, and malaise, mumps, chemicals like phentamine, alloxan, streptomycin, bovine milk protein, and geographical as well as the seasonal changes may initiate the autoimmune destructions of beta cell. And next is number 4 is genetic factor. Genetic factor, what happens? Genetically, the predisposing factor of type 1 diabetes are associated with two genes, that is DR3 and DR4 on chromosome 6 present on human lymphatic antigen HLA regions. An individual with one or both of the genes is relatively more prone to the DM. That means if any individual is having the DR3 or DR4, then the person is more prone to the DM. And about 90% of people suffering from DM shows that the presence of either one or both the genes, and in them beta cell act as a auto antigens and stimulate the CD4 plus T lymphocytes and bring about their own immune mediated destructions. Okay, this is about the pathophysiology of our type 1 diabetes. Next is pathophysiology of type 2 diabetes. In that, first one is what? Insulin resistance. The basic underlying cause of occurrence of type 2 diabetes is insulin resistance. That is, peripheral tissue do not respond to the insulin. When our peripheral tissue is do not respond to the penicillin, that means the body is already producing the sufficient amount of insulin, but the peripheral tissue is not respond to this insulin, and due to this, the blood glucose level is increasing. Okay, they are mainly due to the obesity. What happened in this flowchart, I will show you. Then first, obesity or excess abnormal fat is occurred, and then due to the anti-epileptic actions of insulin is inhibited. Okay, due to this, the high level of free fatty acid is occurred, and then that is development of insulin resistance in the liver and muscle. Okay, high level of free fatty acid which is develop the insulin resistance in liver and muscles, and then it is increase the gluconeogenesis in liver, and that decrease the glucose uptake by the muscle, and due to this, the increase in blood glucose level. Okay, that means what happened, due to the gluconeogenesis in liver, then the muscle of the body is not uptake the glucose, okay, from the blood vessels, and due to this, the blood glucose level is increases. Okay, it is number 1, insulin resistant. Okay, type. Number 2 is what? Impaired insulin secretions. What happens in that, when the beta cell function get impaired eventually, and the required amount of insulin is not secreted, leading to insulin deficiency. Okay, and the cause of destructions in the level of insulin is not clearly established, and but it may be due to glucose toxicity around islets of Langerhans, which may impair the function of beta cells, lipotoxicity, that is increase the free fatty acid level, and deposition of fibrillary proteins around the islets of Langerhans by amylin, which may impair the function of beta cell. In impaired insulin secretions, what happens when the beta cell is unable to secrete the insulin which is required for the body, and due to this the insulin deficiency is occurred, and due to the insulin deficiency the blood glucose level is increases. Okay, and this is the what are the destruction level of the insulin is not clear nowadays till date, and so that there is some assumption is there. Part one is what the glucose toxicity around the islets of Langerhans. When the glucose toxicity is occur around the Langerhans islets, and due to this what happened the impaired function of beta cell is occurred. And number B is lipotoxicity, where the increase the fatty acid levels, and number C is deposition of fibrillary protein around islets of Langerhans by amylin, which may impair the function of beta cell. And number 3 is genetic factor. The type 2 diabetes is also linked to the presence of metabolic syndromes or syndromes X. Okay, more by individual with the parental history. If someone having the history of diabetes, then there are higher risks to develop the type 2 DM. That means if anyone parents, this mother or father is having the diabetes, then they are having higher risks to develop the type 2 diabetes. And number 4 is constitutional factor. Constitution certain disease like the hypertension, high, high physical exercise or obesity may contribute to the occurrence of type 2 diabetes. Okay. Next is the clinical manifestations or signs and symptoms of the diabetes mellitus. First one, what? Always thirsty. The person is feeling always thirsty. Next, number 2 is blur visions. That means when the person is seeing, then she will see the blood. Won't help of, and that means if diabetes persons cut getting some cut or any type of wound, then it won't help um, in short times. And vaginal infections, always hungry, always start sexual problem, numbness of tingling in the hand or feet, and frequently urination, that is called polyuria, and systemic weight loss. This is the clinical manifestations of a diabetes persons. Okay, or signs and symptoms of diabetes mellitus. Next is the complications of diabetes mellitus. There are two types of complications. One is short time complications and another one is long time complications. Okay, in some short time complication is diabetes ketoacidosis. Okay, this is the diabetes ketoacidosis, acidosis, and hypersomal hyperglycemic state. This is the short term complications of diabetes, and long term is macrovascular disease. Macrovascular disease means this disease arises from the damage to the large blood vessels. Okay, this disease arises from the large blood vessels in our body, which are the large blood vessels that is damaged by the diabetes mellitus. Okay, and they mainly include the cardiovascular disease and peripheral vascular disease. Cardiovascular disease, there are approximately 80% of death in the patients suffering from type 2 diabetes due to CVS damage. Okay, and peripheral, that is there are arteries of the leg are affected, leading to the claudications and cramping, pain while walking. Okay, these are the some complications of macrovascular disease. Okay. Next is the microvascular. Microvascular means they are disease which are occur due to the damage to the small blood vessels. Okay, and they are include the retinopathy, that is nephropathy, peripheral neuropathy, etc. And microvascular disease infecting the diabetic food ulcer and common. Okay, here are the some complications of diabetes mellitus. This I show you in the, this is the stroke or the, this occur due to the diabetes mellitus. It is the diabetic retinopathy. This is the diabetic neuropathy, and it reduces the blood flow. Diabetic nephropathy, diabetic foot, and diabetic cardiomyopathy. These are the some complications of diabetes mellitus. Okay, thank you for today class.